Good day. I'm Dr. Julia Yulde-Cruz, an adolescent medicine specialist. First, I would like to thank the San Pablo Medical Society for inviting me to talk about this relevant topic on promoting mental wellness in adolescents during this period of pandemic. So adolescence is about developing social skills, empathy, and a sense of identity, which majorly results from the interactions with peers. The COVID-19 crisis places these young adults under great psychosocial stress from isolation and threatens to set them back in these critically important social and emotional phase of development. The emotional impact of crisis and the lockdown measures has caused them to suffer from forced social isolation in powerful ways, both in long term and short term. So, short term loneliness may encourage them to engage in risky behaviors, while protracted loneliness can generate mental health issues. Even before the pandemic, the World Health Organization reported that worldwide 10 to 20% of children and adolescents experience mental health conditions, and half of all mental illnesses begin by age of 13. And it was found that neuropsychiatric conditions are the leading cause of disability in young adults in all WHO regions. So the awareness is indeed growing, and we're seeing the significant impact of mental illness in early life. Now, if untreated, these conditions severely influence a person's development, their educational attainments, their potential to live fulfilling and productive lives. And they also face major challenges with stigma, isolation, discrimination, lack of access to healthcare and educational facilities. And as a result of COVID-19, children and adolescents have experienced unprecedented interruptions to their daily lives. And it is anticipated that these disruptions may be precipitants of mental illness, including anxiety, depression, or stress-related symptoms. The disease outbreak, the restriction of mobility, the closure of schools, long screen hours, the constant negative media coverage, the lack of discipline and clear time boundaries, and the lack of social gatherings and interaction, and the mental state of parents and caregivers are all contributing to stress and anxiety among our children and adolescents. And so this brings me to my objective today. How do we promote mental wellness among adolescents? Now, with 1.2 billion adolescents in the world today, all of us have a stake in helping them reach their full potential. But before that, let me define mental wellness. Mental wellness is the ability to return to normal functioning after experiencing psychological stress. So this doesn't mean never having to feel stress. The stress response is really known to affect cognition and mood, that when triggered, it sometimes results to distorted thinking, uneven moods, and poor behavior. And so mental wellness is a state of mind where you are able to self-correct psychologically. And how do we achieve that? So a key to improving mental health is remembering our grandmother's wisdom. Eat your veggies, get enough exercise, go out and play, get enough rest, and take time to relax. So we can see the critical first steps is really optimizing lifestyle, which include good sleep hygiene, optimal nutrition, and adequate physical activity. So inadequate sleep alone has been found to be a risk factor for anxiety and depression. Although anxiety and depression in turn may lead to poor sleep quality and sleep quantity. So the National Sleep Foundation defines adequate sleep in adolescents as having a sleep duration of 8 to 10 hours per night. And the optimal hours of regenerative sleep, this is when the cortisol, our stress hormone, is at its lowest and the growth hormone at its highest, is between 10 p.m. to 2 a.m. So we want them sleeping by this time. But what gets in the way in obtaining optimal sleep? No, stimulating activities like watching TV, using the gadgets, and sometimes reading, all can prevent us from sleeping. And at least 30 minutes before sleeping, all of these activities should be stopped. Now, parents can set a media curfew. Next is avoiding long daytime naps. And of course, caffeine in the diet don't help. So optimize what helps, no? What helps to get us back to sleeping? Exercising during the day, optimizing the sleep environment. So the room should be quiet, dark with minimal to no distractions. Now, having a regular sleep schedule. Sometimes we allow our children to sleep later during the weekends, and the problem with this is that it throws off their circadian rhythm. So we have to limit the sleep difference to not more than 1 hour. Let's go to nutrition. Proper nutrition is essential to a healthy body and clear mind. So it was found that among young people, many suffer micronutrient deficiency, and micronutrients, which are the vitamins, minerals, and phytonutrients from fruits and veggies, serve as critical cofactors for the enzymatic processes that allow us to convert macronutrients, which are our protein, fat, and carbohydrates, into energy. So with an inadequate daily supply of micronutrients, we really run the risk of our cells functioning suboptimally. Unfortunately, processed foods that most teens love to eat are depleted of these micronutrients. So another evidence that show that food impact mental health is omega-3 fatty acids found in fish oil. Omega-3 has shown to improve response to psychotropic medications for mood disorders. And this suggested that mood disorders might actually be a pro-inflammatory state that benefits from omega-3, which is an anti-inflammatory property. So just as important as the quality of food is the timing of food intake. Now, common among teens is skipping of breakfast. And skipping meals, most especially breakfast, puts the body in a starved state that results to a cycle of increased hunger, overeating, a spike in insulin, and a sudden drop in the blood sugar. So this unsteady supply of glucose in the brain compromises cognitive functioning and decision making. And so we recommend to eat right and regularly. Breakfast should include a protein complex, carbohydrates, and essential fatty acids. And remember that eating small, frequent meals is better than skipping meals. Now, exercise has long been linked to beneficial effects on overall health, including mental health. So Elle Woods once said, exercise equals endorphins. Endorphins make you happy. But actually, dopamine has been linked to this effect as well, together with increasing the blood flow and nutrients to the brain, altering brainwave activities, and increasing restful sleep. So when you are stressed, your body is actually saying run. Now, so do it. Of course, since we can't go out, we can do it in place. You might think you don't have the time to exercise, but that is actually when we need it most. And you will be able to think better after you have used up those stress hormones. So specifically, aerobic exercises, strength training, and yoga have shown beneficial effects in improving mental wellness. But the best exercise is something that one enjoys and will maintain over time. And this is ideally done 3 to 5 times a week at a minimum of 20 to 30 minutes a day. Next is recreational activities or rest. Now, we often discount the value of active relaxation. This includes engaging in hobbies or creative activity, having some quiet and structured time, spending time in nature, meditating, doing breathing exercises, a mindfulness activity, or a prayer. So all these are doable in spite of our current situation. We can do this together even as a family in our homes. Now, it has to be a conscious effort to have it as part of our daily routine. It allows our minds to rest, pause, and be present. Now with online learning, teens are almost in front of the screens all day. We tend to underestimate the impact of being online the whole day, and the overstimulation of the screen and the instant gratification it offers prevents the mind from resting. So TV and using gadgets do not actually engage the brain in the same beneficial way as the activities I mentioned. So when I say rest, it means the body and the mind. Now with the current pandemic, it is common to notice changes in your mood, such as increased irritability, feeling low or more anxious. You may experience difficulty sleeping. You may feel exhausted more often, or it may feel harder to relax during lull periods. And it is natural to feel this way during difficult and uncertain times. And there are many things you can do that can help. So aside from optimizing lifestyle by doing the things I mentioned earlier, connect with people you trust. Contact your friends and family, and if you are comfortable, share your concerns and how you feel. Keep in touch with family and friends through email, phone calls, and making use of social media platforms. Don't resort to tobacco, alcohol, or other drugs to cope with your emotions. These are not solutions. I have a plan of where to go and seek help for physical and mental health and psychosocial issues if needed. So sometimes parents are more anxious about seeking mental health services. And this sometimes leads to denial or minimizing of the real issues our teens are going through. Next is decrease the time you and your family spend watching or listening to upsetting media coverage. So parents teach your teens to search in reliable sources of information and limit this to perhaps 1 to 2 times a day. So this avoidance strategy is not to leave our teens ignorant of what's going on. No, it's actually teaching them or teaching our young people to consider their triggers to stress and to realize that sometimes it can be avoided. And for my last tip, helping a little can make your world better and help you feel better. So children and adolescents who consider how to serve their family, community, and the nation usually feel good about themselves because they have a sense of purpose and they benefit from making a difference in other people's lives. And since they know how good it feels to serve, they feel no shame in reaching out for help when they need it. Next is children and adolescents who serve others become surrounded by gratitude that reinforces positive behaviors. So this is especially important among teens who often are recipients of low expectations. And this helps them feel competent and strengthens their connection. And people who serve others may be better able to put their own problems in perspective because they get a wider grasp of reality and they learn to appreciate what they have. And for my last slide, this is what we want our teens to develop in these trying times: resilience. Now, because we cannot take away all exposure to risk and shield our teens from catastrophes, now we just have to make sure they are equipped with a wide repertoire of coping strategies, because when they do, the path of least resistance during stressful times like this will be the one that leads to healthy adaptive behaviors. So that is the end of my talk. Thank you for your attention. These are my references.